dear Ambassador Skorpen and Professor Peter Hotes, my friend, if he's in the audience. It's a great pleasure for me to give you this keynote address at this important conference. I will briefly cover 5 points. One is a little bit about myself and aging. The second is about the evolution of global health. And then the major point, the global health security agenda. And then a touch on R&D and from a point of view of Norway, what assets we can bring to the table in this context. So first, a few words about myself. I've been in health and global health R&D for more than 50 years and worked in tropical diseases. I was the founding CEO of CEPI. I worked in the Prime Minister's office in Norway with Prime Minister Stoltenberg, and then 10 years in Foreign Affairs. And now I was called to the Minister of Health last year to help out with the pandemic. I also helped start CEPI, the organization for developing vaccines against outbreak diseases. I am 82 years old, and so in terms of aging, I would say that one of the most important things to keep fit and well is to be allowed to contribute to the challenges in the world. In relation to the evolution of the term global health, we started with tropical diseases in poor countries. And when we started GAVI for the first time, as far as I remember, we coined the term the Global Alliance for Vaccines and Immunization. And subsequently, the Global Fund also used that term. It meant that one focused on diseases of poor developing countries. Then, when the Ebola epidemic struck in West Africa, I got very concerned when the number of cases were doubling every week in October 2014, and I thought, now we need to develop a vaccine, because the projections by CDC were that about 600,000 people could die and it could spread to different parts of the world. So in terms of surveying the different candidates, I selected the VSV-based virus, since it could be given by only one injection. And we did the study in Guinea, and we selected Guinea because we thought that was perhaps the country where the epidemic would last longest. And we then worked very hard, in close collaboration with WHO, and by July 2015 we actually had the results, and we had to adopt a method of ring vaccination. So we vaccinated the communities, randomly selected those communities that had a case and those communities that did not have a case. And we could demonstrate that the vaccine gave a very high level of protective immunity. That was a tremendous breakthrough, also that you could show that you could do a vaccine development during an epidemic. That led to the concept that we needed to establish an initiative to actually be able to develop such vaccines in a more systematic way and to do it during peacetime. So then the CEPI, the Coalition for Epidemic Preparedness and Innovation, became established in 2017. We raised about $500 million then, and just the day before yesterday, the replenishment took place and one raised $1.5 billion. When we thought about the development of the vaccines for the epidemics, we thought it was a high probability that there would be a disease with an unknown virus, and therefore we invested in platforms that we called platforms for disease X. And one of the platforms were mRNA, and we invested in Moderna for the development of mRNA for taking care of then unknown diseases. So that was then the platform on which one could actually then address the COVID-19 pandemic and to develop a vaccine, as you all know, in record time. Now turning to global health security. We were part of the Global Preparedness Monitoring Board that was established in 2018 with Gro Harlem Brundtland as the co-chair, and I served as her Sherpa. The first report we made in 2019, September, the title was "A World is Not Prepared," and we emphasized that the world was not prepared for a new pandemic. And we thought we were very bold in describing the serious consequences of a pandemic, both socially, economically, as well as in terms of lives. And then, as you know, a few months later, the COVID-19 struck and surpassed our boldest fears in terms of a pandemic, its size, the number of people that have died, the economic and social consequences, as you all know. We also emphasized in that the world in the past had always panicked during a pandemic, and then they had neglected to follow up to prevent future pandemics. And this time we have been working hard, also in the Global Preparedness Monitoring Board, to emphasize that we now need to prepare in a much better way for the next pandemic that is bound to come in 3, 5, or 10 years' time. So that work is going on, but I must say I am not optimistic that the world will take the necessary actions this time either. It is a fragmented approach that we are seeing. The world, as you know, is in the polarized world, and particularly now also with the conflict in Ukraine, that to get a consensus, an agreement around actions that should be taken, I'm quite concerned. But I hope that in particular the summit that President Biden is then calling on in April this year will be the starting point for concrete actions, as there has been many words so far, but action has been lacking. In this regard, I think that all of you in this conference will be able to contribute importantly to help us prepare for the next pandemic. We need to work in peacetime before in order to be prepared in the best possible way. Now moving to R&D, and since you are all experts in R&D, I will not touch upon this topic in any significant way. But I know that cancer research will be an important topic of this conference, and I would remind you that the time it takes from a basic discovery to actually you have it applied in clinical settings and to the help of patients can be 2 to 40 years. We should be reminded that George Köhler and Cesar Milstein discovered monoclonal antibodies in the mid-1970s. And similar, at the same time, Howard Varmus, together with Michael Bishop, discovered the oncogenes. But it was only in the 90s that one actually were starting to be able to apply this to clinical settings. And today, as you all know, the use of monoclonal antibodies and the discovery of oncogenes are central in developing immunological tools, both immunotherapy as well as vaccines in the treatment of cancer. It is in fact the most rapidly moving area of cancer research today. And I just like to tell you that my sister was discovered with a colorectal cancer in 2012. But thanks to modern therapy, including immunotherapy, she is still very well and very active, in spite of the fact that she had spread of the cancer in 2012. So this is a hopeful personal experience in terms of what modern approaches can do to cancer. Finally, I would like to mention then what assets, from my personal point of view, I think that Norway can bring to tackle many of the aspects that you will discuss in further detail in the conference. And I would say, first of all, Norway has very good registries of people and of patients. And it is not by accident that actually the side effect of the AstraZeneca vaccine against COVID-19 was discovered in Norway. So that is something that can also be an important asset for you in your deliberations. The second is that Norway is, I think, a leader in global health. Actually, President Obama, when he visited Norway in 2009, said that Norway was boxing above its weight in global health. And so we have a very substantive investments in global health, particularly as it comes to per capita. And this can also be an asset as you are going to consider how to challenge, to challenge and to prepare for the next pandemic. And finally, I would say that Norway, with its strong economy, in recent years have actually developed venture capital. It is private people that are now investing in R&D in Norway, and that can bring the tools from the laboratory bench to the clinical setting, to the bedside. So with these opening words, I would like to then hope that you will have a very good conference, and I look forward to follow up in terms of the outcomes of this conference. Thank you very much.